Well, hello, and thank you for joining us for this webinar, What's in Store for 2024, Key Health Plan Compliance Requirements. As we were rolling into the new year and kind of thinking about all of the things that we have to help our clients with or that we're concerned about for our clients, the list is pretty long, and frankly, it's even longer than what we've covered or we're going to cover here in this webinar. But we thought we would give you some key things to think about now, even though it's early in the year. Just some things to think about now that you're going to need to be preparing for later, because they're really not things. A lot of the things we're going to talk about today are not things you can wait and do even a month before the deadline. You need to be working on these right now, and so we're grateful to you for spending some time joining us. I'm joined with my partner, Melissa Cottle, who's super smart. She's been here at the firm forever, keeps me honest. She's very, very good lawyer, and she's going to cover, we're going to kind of tag team and divide and conquer, where she'll cover some parts and I'll cover others. And so here's kind of the list of the topics we're covering today, or the primary things. We may cover a few additional items. We're going to talk about the gag clause attestation requirement. Melissa's going to cover that. I'm going to cover mental health parity and all of the rules related to the mental health compliance requirements. PBM legislation, this continues to be, we've done a webinar on this topic by itself because this topic continues to be an ongoing issue for us. Prescription drug reporting, there's kind of a deadline coming up this summer that Melissa's going to talk about. This is one of those items you need to be kind of getting ready for now. The online shopping tool requirement, which is in place at the moment, Melissa's going to talk about that. I'm going to cover the prescription drug machine-readable file requirements, which the government has issued some kind of weird FAQs on this topic recently, and kind of what that might mean for you and your health plan and your consultant. And then we're going to close with gene therapy drugs, and maybe even talking about, because it's related, if this kind of explosion of people using drugs like diabetes drugs for weight loss purposes, and what the costs might be, and what your options are as an employer as it relates to that. So we got a lot to cover.